I'm going to explain two different scenarios for you. First, there's person A. Person A is a 45-year-old man with a wife, 2 kids, full-time paying job, and lives in Nashville, Tennessee. And now there's person B. Person B is also a 45-year-old man with a full-time paying job, a wife, 2 kids, and also lives in Nashville, Tennessee. But the one difference is, person B was diagnosed with type 1 diabetes at a very early age and needs constant injections of insulin in order to maintain a healthy blood sugar level. This one major difference in the lives of person A and person B will end up costing person B thousands of dollars every year for health insurance alone because they cannot enroll in Tennessee Farm Bureau Insurance's health benefit plan due to their pre-existing condition. Farm Bureau Insurance has been allowed to continuously discriminate against people with pre-existing conditions, which is negatively impacting the lives of those who need it most. It is an unjust system that needs to change. Before the passing of the Affordable Care Act, ACA, better known as Obamacare, insurance companies could regularly deny people insurance due to pre-existing conditions. 50 million people were affected by this, and of that, 17 million were children. 47% of those that sought private insurance did not receive it. This lack of insurance comes from either outright denial, the possible exclusion of a person's condition on the proposed benefit plan, or higher rates and deductibles. However, the passing of the ACA has changed the law so that companies cannot refuse someone insurance due to their pre-existing condition. This covers discrimination against conditions such as AIDS, Alzheimer's, alcoholism, diabetes, cancer, drug abuse, kidney failure, pacemakers, Crohn's disease, heart attacks, fatty liver disease, rheumatoid arthritis, stroke, mental health counseling, intellectual disabilities, pregnancy, obesity, and others. As you can tell, there are a lot of conditions that go under this pre-existing condition umbrella. That's why it's imperative that all these people get the help that they desperately need. These rules went into effect on January 1st, 2014 for all health benefit plans starting at that time or afterwards. Tennessee Farm Bureau Insurance has managed to dodge this ACA revision. Farm Bureau began avoiding regulation back in 1993 and has since been undermining the goal of providing equitable and affordable health insurance for all. Farm Bureau denies coverages to those with a pre-existing condition, especially an expensive one. The application for Farm Bureau is longer than that for the ACA. High-cost concerns such as cholesterol levels, glucose levels, cranial problems, heart problems, age, and history of tobacco use are just a few that Farm Bureau screens for before doling out health care. Now, you might ask yourself, if Farm Bureau can do this, why can they do it at all? Like, why do they have to comply to the same rules as other insurance companies? Farm Bureau is technically not viewed as a health insurance company, and thus they do not have to follow the regulations of all other insurance companies. This creates situations where they can discriminate against those who do suffer from pre-existing conditions and exclude them from joining their plans. This would also lead you to ask, if they're so discriminatory and rates can continue to increase once I get sick, then why would I go and get Farm Bureau insurance in the first place? The answer is simple. It is one of the cheapest options on the market. If you do not qualify under any pre-existing condition umbrella, then you will save a lot of money. For a Tennessean, the ACA's plan can cost about $860 per month for health insurance, while Farm Bureau's traditional plan can cost you as little as $283. Premiums and deductibles for plans outside of the ACA can run bills up to $12,000 for 1 year alone. These numbers come from Phil Yates, who is both a diabetic and a Tennessean, and has faced these problems on a first-hand basis, and also from Stat News. Farm Bureau has created a problem within the insurance market. Those with pre-existing conditions are stuck paying for the more expensive plan because they are left with no other options. Those with pre-existing conditions are typically paying for more expensive procedures, medications, and appointments in general, yet because of their lack of access to affordable plans, they are left with no other options when it comes to providing for themselves. People with pre-existing conditions should not be discriminated against because of their health. Forcing someone who is sick to pay more for health insurance is equivalent to forcing the uneducated to teach themselves while providing easy access to teachers and resources for people who already have an education. You are keeping the disadvantaged at a disadvantage because of their disadvantage. So what is the plan going forward? And to be perfectly honest, I don't really know what all the next steps need to be made. It's a complex solution with no easy fix, and I wish I had all the answers. Forcing insurance companies to make people pay more or the same rate will cause everyone to pay more, especially those who are healthy, and that is not the goal I'm trying to accomplish. I don't want to raise their rates. This can also put some insurance companies out of business as they do not have the means to support these higher cost conditions. The goal here is to make insurance accessible and affordable to all. And while Farm Bureau is not obligated to play by the letter of the law insurance companies, they should institute some sort of opt-in option for those who have pre-existing conditions. This could allow those with pre-existing conditions to get on to these cheaper plans, even though the rates would be increased, but it would still be cheaper than the ACA plan. Another option would be to incorporate high-risk pools, something that would allow the amount of healthy applicants to be consistent, yet put people with pre-existing conditions on these cheaper plans. They would be aware that their premiums, deductibles, and rates could be increased, but again, it would still be cheaper in the long run. And high-risk pools were typically used by states before the pre-existing condition mandate put in place by the ACA, because private insurance could just outright deny someone coverage. Completely denying access to those who are suffering both physically and monetarily should resonate with an insurance company because it is the exact opposite of what they're trying to accomplish. It is fitting that the headline on Tennessee Farm Bureau Insurance's website is "Wherever you are, you're covered," and not "Whoever you are, you're covered." It is fitting that they do not have everyone's best interest in mind. In conclusion, it is undeniable that Tennessee Farm Bureau Insurance provides affordable health insurance to healthy residents across the state. Tennesseans do not have to pay for the more expensive ACA plan, that is, unless they have a pre-existing condition. I do not believe that the 1993 regulation, which allows Tennessee Farm Bureau Insurance to kind of jump through this loophole, should be repealed. However, I do think drastic changes need to be made in order to allow equitable and affordable health care for all. The ACA was passed to provide affordable health insurance to everyone, regardless of circumstance, especially given a pre-existing condition. And Farm Bureau Insurance is undermining that progress and continuously allowing discrimination to occur. That needs to change. Thank you.